Good morning, everyone. We still have a lot of people signing in, so I'm going to wait just a minute or two before we actually start.
Frank, do you want to go over the technology part while we're waiting?
Actually, I was going to ask Ed to do that, but.
All righty.
I can't change my slide.
Uh-oh. Okay, everybody just hang on 1 second. Frank, why don't you stop sharing for a minute and then share again.
Yeah.
There you go. You got it.
Not sure how that happened, but yes.
No worries. Okay. And I think we're okay with starting on time because
okay.
The folks came on time.
Okay, well then let me just welcome everyone. Before we get started, we want to do a little bit of housekeeping. So Ed, if you want to do that.
So at the bottom of your screen, good morning, I'm Ed from Kona. You'll see some icons down there that will allow you to get in touch with us. And there's three, there's a chat, a raised hand, and a Q&A. We will be using the Q&A function. So at any time during the presentation, you have a question, just click on Q&A, type your question, and I'll be monitoring those. And some of those will answer during the course of the presentation, and some will wait till the end. But if you have a question, put in Q&A. Chat, if you need to use chat, that's only if you have a technical issue with not being able to see or hear us, then you can put it in chat. But if it's a question per the content, please use the Q&A.
Okay.
Also, for those who don't enjoy the live transcript feature, you can turn that off. Frank, can you go back one slide?
Mm-hmm.
So if you look under,
yeah.
okay, whoops. If you look at the bottom of your screen, you should see a CC transcript button. If you click on that, you'll get the opportunity to hide the transcript if you don't want to see it. So again, that's under either more or CC live transcript, and you can hide that if you do not want to see it. Thank you. And while I'm in here, by the way, this is Jackie Boland, Community Outreach Director. Thank you so much for coming. I do want to let you know that we are recording the session. We will be posting it to the original landing page that you registered from. I have put that in the chat. The previous sessions are in there too, so if you did miss one, you can go back and view them. Thank you.
Okay. Before we get into the content, we want to have a brief commercial from our sponsor. AARP Hawaii is a nonprofit, nonpartisan organization. We have about 140,000 members here in the state, about 38 million nationwide. And AARP's mission is to provide information and resources to help people live their fullest life possible. And this program today is just one more example of how AARP supports us as we prepare for retirement and to lead our fullest lives possible. And Jackie, once again, my screen won't move. I'm not sure what's going on here.
Frank, I'm going to go ahead and share from my screen. You can just tell me when you want the slides forwarded.
That would be great. I don't know why I have stuck here.
Okay, no worries. Hold on. I'm sorry. Everybody take two. Stop.
Yep.
Are you folks seeing that? No.
I can see it, Jackie.
Okay, terrific. So I'm going to go ahead and move forward. Again, if you're just joining us and you do not wish to see the live transcript, you can turn it off in the bottom right-hand corner. If you have a question for Frank, you can put it in the Q&A. We apologize for the delay, and we'll go ahead and get started right now.
Okay, our agenda today is to cover Medicare basics, what Medicare covers, what it doesn't cover, what are the costs, what are the parts of Medicare, then the choices that you make as you begin to get your Medicare benefits. There are choices that you get to make about how you want to receive those benefits. And then last, we're going to spend some time on giving you some resources and some tools that will help you if you have further questions and help you explore Medicare further. Okay, Jackie. Okay, let's go over Medicare basics. Next slide. Okay, Medicare is a federal health insurance program for people who are age 65 and up, but it also covers people under age 65 who have certain disabilities. And it also covers people of any age that have end-stage renal disease, that need renal dialysis or kidney transplant. And it also covers people with ALS or Lou Gehrig's disease. So it is a fairly extensive program. Next slide. So we're going to ask you some questions here to sort of get you thinking about Medicare. So we have, I think we have 2 polls, and Ed is going to put those up. What doesn't Medicare cover, or what does it cover? So does Medicare cover long-term care services? Yes, no, or unsure?
That's a pretty good sampling.
Okay, let's end that. And, you know, the correct answer obviously is no. And I think lots of people, and again, some of you said yes, and quite a few of you said you were unsure. Medicare does not cover long-term care services. There are some limited circumstances, and we'll talk about those where it covers care in a nursing home, but it does not cover long-term custodial care. And I think we have another question about Medicare coverage. So, Ed? So, question here is, what else does Medicare not cover? Cosmetic surgery, eyeglasses, hearing aids, healthcare outside of the United States, all of the above, or boy, I have no idea.
I think that's a good one. Yep.
Yeah, most of you have voted. And again, the correct answer for this is all of the above. Obviously, most insurances don't cover cosmetic surgery, but it's also a surprise to people to learn that Medicare does not cover eyeglasses, contact lenses, sort of routine eye care. It doesn't cover hearing aids. It doesn't cover healthcare outside of the United States. So those are just some of the examples of things that Medicare doesn't cover. And for those of us who are transitioning to Medicare from employer-based coverage or union-based coverage here in Hawaii, where all of those things are covered, it's usually quite a surprise to learn that Medicare doesn't cover these things. So, okay, so let's go to the next slide. Okay, so when you enroll in Medicare, you're still going to be responsible, just as you are with whatever insurance you have before you go on Medicare, for certain costs. There are monthly premiums that you will have to pay, and we'll go over those in detail. You'll be subject to deductibles, and it's more than one, and we'll go over those. You'll be subject to coinsurance, which is a percentage of the cost that you will be responsible to pay. And you may also be responsible for certain co-payments, and that's typically for prescription drugs. So we'll go into those in a little bit of detail. Next slide, Jackie. So we also need to talk a little bit about the different parts of Medicare. And there are 4 parts labeled A, B, C, and D. So we'll start with Part A. So Part A is hospital insurance. This is the part of Medicare which helps cover the costs of inpatient care, covers hospice care and some home health care that is immediately following a hospital stay, and some skilled nursing care. Also, skilled nursing care, such as care you might need for rehab after a knee replacement surgery in a nursing home. Next. So what are the costs in 2021 for Part A? Most people pay no premium for Part A, and this is because while you've been working, you have had a Medicare tax deducted from your paycheck, and it has also been paid by your employer. So you've already paid the premium for Part A if you've worked for 10 years. If not, you can buy into Part A by paying a premium. For 2020, whoops, let's go back, Jackie, please. Okay. There is a deductible for Part A, and that this year is $1,484 for the first 60 days of inpatient care. If you've been out of the hospital for 60 days and you're admitted again, the deductible applies again. It's not an annual deductible, it's a deductible for every 60 days. So that can add up if you're hospitalized more than once. Okay, now next slide. Part A, you're going to be subject to coinsurance or additional copays. For the first 60 days, there's no additional coinsurance, but if you, heaven forbid, are hospitalized for more than 61 days, you're going to pay $371 a day. And if you're hospitalized more than 91 days, you're going to pay $752 a day, but you only have 60 lifetime reserve days above that 91-day limit. So once those 60 days are used, you pay the full cost of hospital care. So, okay, next. Before we go on to Part B, let's just check to see if there are any questions so far about Part A or anything that we've covered so far. Ed?
Nothing here yet, Frank.
Okay, we'll plow on then. And don't be afraid to put some of your questions in the Q&A, and we will try to get to them. Certainly we'll address them before the program ends. So Part B is your medical insurance. This is the part of Medicare which covers doctor visits, outpatient hospital services, durable medical equipment, such as wheelchairs or walkers. It covers Medicare-approved preventive services, so mammograms, flu shots, colonoscopies. And because of the Affordable Care Act, the Medicare-approved preventive services have no copays or coinsurance. They're 100% covered. And Medicare added, partly in response to the pandemic, telehealth services are covered in 2021 under Part B. Next. So the Part B costs in 2021, the standard premium for Part B is $148.50 per month for those who enroll in 2021. People who have higher incomes will pay a higher premium. That applies to individuals who earn more than $88,000 or couples who earn more than $176,000. There is an annual deductible for Part B, which is this year $204. And for Part B, almost all services have a coinsurance of 20%. That means that Medicare pays 80% of the cost and you have to pay 20%. Okay, next. Okay, before we dive into Part D, let me ask Ed, are there any questions so far?
So Frank, here's a couple back, Part A. Can you clarify the lifetime reserve care?
Okay.
Are those 60 days in a lifetime or just for that calendar year?
No, it is 60 days for a lifetime. So if you happen to be hospitalized for more than 90 days, you have 60 lifetime reserve days to call on to cover, any additional stay. So that's a decision that you may have to make in terms of whether you want to apply them or not. Fortunately, being hospitalized that long is exceptionally rare. So most people don't have to confront this issue, but it is part of the Medicare design that you only have 60 lifetime reserve days. And if you run into a hospitalization that is longer than 90 days.
This is Jackie. Can I ask a hop-on question on that? If people buy a Medigap policy, they could get additional coverage, right? It's just
We're
the
going to
base,
talk
the
about
base
Medigap
Medicare.
policy.
Okay.
That's correct. We're going to talk about Medigap policies, which give you a way to cover that. And also Part C, which is Medicare Advantage, doesn't have that limitation.
So Frank, going back again to Part A, the question is, if my wife hasn't worked, will she have to pay Part A premiums?
If she hasn't worked at all, then yes, she will have to pay a Part A premium. And I'll show you a resource where you can look that up towards the end.
Okay, I think we can keep going, Frank.
Okay, let's talk about Part D. We're skipping Part C for now, but we'll come back to it. Part D was a benefit added by Congress in 2006 to Medicare to help cover the cost of prescription drugs that you pick up at the pharmacy. It is not run by Medicare. It is run by Medicare-approved private insurance companies. And each of those prescription drug plans offered by those companies may differ in how they actually cover specific drugs. For example, you might be taking a cholesterol drug, and one plan will cover that under, let's say, Tier 2 as an approved brand name drug, and another plan may cover it under Tier 3 as a non-approved brand name drug, and you'd pay a higher copay. And I'll show you how you can figure out how those plans cover your drugs so that you can make a good choice about which of those plans will be best for you. Next, Jackie. So in 2021, people enrolled in Part D may have to pay a monthly premium, and that averages about $30 a month this year. But there are some plans, even plans available here in Hawaii, that do not charge an additional premium for Part D. You're likely to pay either co-payment when you pick up your drug, $10, $15, depending on the tier it's in, or a co-insurance. And the drug plans can require an annual deductible up to $445. Many of them have either a lower deductible or no deductible. And just like Part B, people with higher incomes will pay a higher Part D premium. Okay, next. Go back one. Now, this is unfortunate. We need to go back one, Jackie, yes. You may have heard about a prescription drug donut hole in Medicare drug coverage. And this started when the Part D benefit was created, Congress didn't have the money to fully fund it. So there was a donut hole that people fell into after they had spent so much certain dollar amount where they actually had no coverage until they reached a catastrophic level where their coverage resumed. The Affordable Care Act has technically eliminated the donut hole, so we don't have to talk about that anymore. Right now, both before and after you're in, quote, the donut hole, you pay about 25% of the cost of your prescription drugs through your copays and coinsurance. The donut hole starts when you have spent, and you and your drug plan have spent $4,130. But again, that's really not a relevant number now. What is relevant is that after your personal out-of-pocket spending reaches $6,550 in a year, you only pay 5% of your covered costs for the rest of the year. So there is a catastrophic protection for people who have very high drug costs that limits their drug costs after they have spent $6,550. Now, are there any questions, Ed, about parts A, B, and D?
So Frank, there's a question about the clarification when you're talking about the fact that people with higher incomes have to pay higher premiums.
Yes.
If you're retired, what income would that include? What things would that include when you're calculating the income to determine whether or not you're in a bracket where you have to pay higher premiums?
That's a good question, and I'm not absolutely sure. I believe it is based on what your adjusted gross income is on your tax return, but I'm not absolutely sure of that.
I'm not either, Frank, but I think that's probably the case.
Yeah, I'm pretty sure it's your adjusted gross income on your tax return, because that's how Medicare knows what your income is.
Right. And just another question back on lifetime reserves. Questions, do you have to take them at all at one time? No,
you do not. You can choose when and how if you're in that circumstance, you can choose them, how you want to use those lifetime reserve days. You can hold on to them, you can use a couple of them, or use them all at once if you have to.
Here's a very interesting and important question. So talking about Medicare, are there coverages in Medicare that are for a person plus spouse, or family coverages like in typical insurance coverages from employers?
The answer to that is no. Medicare is individual. So an individual enrolls in Medicare, and we'll talk about enrollment. A spouse, when they're eligible, would have to enroll in Medicare, and there's no coverage for dependents.
Okay, I think that's good for now, Frank.
Okay. So let's talk about the choices that you get to make about how you want to receive your Medicare benefits. In this black triangle is first choice, original Medicare, which includes parts A and part B, and you add part D, prescription drug coverage, and we'll talk about that choice. Or this is where part C comes in. You can choose to receive your Medicare benefits through a Medicare Advantage or Part C health plan that typically always includes Part A and B, and usually includes Part D. So there's two choices and some choices within those that you get to make. So let's look at each of those. So original Medicare is a fee-for-service plan administered by Medicare. And fee-for-service means you go receive a service, that provider bills Medicare, Medicare pays the provider their share, and then you pay your coinsurance or copay. It always includes Part A and B. You can go to any provider that accepts Medicare, and you can have the option of choosing and joining a Medicare prescription drug plan for drug coverage. which you should always do. And we'll talk about that, why that's important. Okay, so that's original Medicare. Now, when you choose original Medicare, you also have an option of buying what's called Medigap coverage, or a supplemental insurance policy. These are sold by private insurance companies. They cover the gaps for original Medicare only. They don't work with Medicare Advantage plans. And what these supplemental insurance policies cover is they will reimburse you for your deductibles, your coinsurance, your copayments. And there are up to 10 plans that have different coverage levels, and you can compare those plans very easily. And I'll show you the website to do that, where you can look at all of the plans, say A, B, or K, that are offered in your area, and see what the prices are for each of the insurance companies for those plans that all have the same benefits. So that is an option. If you take original Medicare, you have the option of buying this Medigap coverage to help cover those costs that Medicare does not cover. So next. So how it works, you can buy a policy within 6 months of enrolling in Part B. You must be 65 or older. And that 6-month enrollment period is important because if you delay beyond that, the Medigap policy company can charge you a higher premium or choose not to cover you at all. So for your Medigap policy, you're going to have to pay a monthly premium, $100, $150, maybe or more. Medigap does not cover any of the prescription drug costs under Part D. It only covers Part A and Part B. Next. Okay. The other choice that you get to make when you are receiving your Medicare benefits is to select a Medicare Advantage or Part C health plan as an alternative to original Medicare. These are plans that are offered by private insurance companies. It's very well regulated by Medicare. All of the plans include Part A and B, and nearly all of them, and I think, in fact, all of them here in Hawaii do include Part D. Now, if you pick a Medicare Advantage plan, remember, if you haven't already, Medigap policies don't work with Medicare Advantage. And if some later date you decide to switch back to original Medicare, you may not be able to purchase a Medigap policy. So that is a consideration when you think about all the things to think about in going to Medicare Advantage, but there are advantages, as the name says. So let's look at those. So Medicare Advantage covers Part A and Part B. It almost always includes Part D, and you can always get a Part D plan. And often, in fact, almost without saying, it's going to include extra benefits that original Medicare does not cover. Most Medicare Advantage plans have a vision and a dental. Some cover hearing aids. Some of them cover emergency care outside of the United States. So some of them have fitness benefits. So you need to look at those plans and look at what are some of the advantages of the additional benefits that they offer. Next. So how does Medicare Advantage work? Well, you've got to live in the plan service area. And there are plans here in Hawaii that cover the entire state, but there are some that don't cover all of the islands. So you have to look at that. You may have to use providers in the plan's network. I think most of you are familiar with Kaiser. If you pick Kaiser's Senior Advantage plan, you have to go to Kaiser for care. You may have to pay an additional premium for Medicare, although many of the Medicare Advantage plans offered are what they call zero premium plans. There's no additional premium other than paying your Part B premium. You may have to follow the insurance company rules, such as requiring a referral to see a specialist, which of course Medicare doesn't require. So these are some of the considerations in picking a Medicare Advantage plan. Next. So for Medicare Advantage, the costs that you incur may include additional monthly premiums. There are likely to be deductibles, although they cannot be higher than original Medicare, and they are usually lower. You may pay co-payments or co-insurance. You may have to follow specific plan rules, but you may also receive some extra benefits that original Medicare does not cover. Next. So let's ask this question before we get into enrollment. Is Medicare enrollment automatic? Ed? Okay, let's end the poll. Most of you have answered. And the correct answer here is no, it's not automatic. Although there is a circumstance where it is, and we'll go over that. So let's look at the next slide. So when do you enroll in Medicare and how? So if you're receiving Social Security at the time you turn 65, you're automatically enrolled in Medicare at age 65. However, if you're not already receiving Social Security, you have a window of 7 months in which you can enroll. You can enroll 3 months before, during the month of, or 3 months after you turn 65. So you have to actually go and contact Social Security to enroll in Medicare. If you delay beyond that period, that window for enrollment, you are likely to have to pay higher Part B and Part D premium. So it's important that you enroll during that period. However, there is an exception. If you are still working or you're still covered under a spouse's employment, you have health insurance that way, you do not have to enroll in Medicare when you turn age 65. In fact, you don't want to enroll in Part B because you're going to be paying a premium from which you're not really going to get any benefit. So you can delay enrollment if you are covered. If you're working for an employer that has 20 or more employees, or your spouse is, and you can delay your Medicare enrollment until you actually retire or your spouse retires, and that coverage is going to end. And at that point, you have an 8-month window to enroll in Medicare. So, okay, let's move on. Okay, so in addition to that enrollment window for your initial enrollment, Medicare has an annual open enrollment each year, usually mid-October to early December, where you can change your choices. You can switch from original Medicare to a Medicare Advantage plan or vice versa, or you can change your Medicare Advantage plan to a different plan if you decide that there's a good reason to do that. Okay, let's pause there before we get to resources. Ed, are there any questions that we ought to address at this point?
So here's I think you just may have answered this person's question. It says, I'm 65 plus, joined in Part A, still working and did not join Part B and D. Should I join Part B and D, regardless of whether I'm working or not?
Yeah, that's a great question. And I sort of forgot to mention that when you turn 65, you might want to go ahead and enroll in Part A. It doesn't cost you anything, but you don't have to. And if you are still working, delay. The advice is don't enroll in Part B and Part D because you're going to pay premiums for them. And Medicare is always going to be secondary to your employer-sponsored insurance. And so that there's no point in paying those premiums because your employer-sponsored insurance is going to be primary. So the right decision is to delay enrollment. If you're still working, your spouse is still working, your employer has more than 20 employees, then you want to delay.
So there's some questions around situations, for example, where you're retired from the state or federal government and you get employee medical from the state or federal government or from the VA. How does Medicare affect those? Because you're getting employer or union sponsored.
Okay.
benefits.
Well, I can speak directly to the state. The state requires you to be enrolled in Medicare Parts A and Part B, because even under their plans, Medicare is going to be primary, and then the state sponsored program, whether you enroll in Medicare Advantage or not, is kind of like a supplemental plan. I am not exactly sure how it works with the federal government or the VA, but it's very similar. Most of those require that you enroll in Medicare as your primary insurance.
And here's a point of clarification. You said if you switch from regular Medicare to an Advantage plan, that you might not be able to switch back. Then you just mentioned during
No,
open
you
enrollment.
can switch back during that open enrollment period. You can switch from Medicare to a Medicare Advantage plan. You can switch from an Advantage plan back to original Medicare, or you can change Medicare Advantage plans. The issue that might arise is if you're switching from a Medicare Advantage plan back to, or switching to original Medicare, you might not be able to purchase a Medigap policy because you need to do that shortly after you turn age 65.
And here's another clarification. If my employer has less than 20 employees, but does provide medical, do I still need to apply for Medicare?
Yes, if they have fewer than 20 employees, Medicare will become primary when you turn 65. So you're going to need to enroll in Medicare. Your human resources person should be able to help you with that, understand that.
And then what's the window for enrollment for Part B and D when you retire if you're in your 70s?
Okay. The window is 8 months. You have 8 months from the time your coverage ends to enroll. And obviously you don't want to wait 8 months. You want to enroll before your coverage ends. But you have an 8-month window without penalty.
I think we're good.
Okay, so let's go on to resources. The first and most important resource is the Medicare.gov website. You can sign up for Medicare, you can sign up and change plans, you can find out your costs, what Medicare covers, you can explore the drug coverage, Part D. On this tab, the supplements and other insurance, you can look up what supplemental plans are available in your area and what they will cost. You can find health plans and drug plans. We'll ask you for your zip code. And it will also ask you, well, if you want to enter in what drugs you're taking, because then when it shows you the plans that are available to you, it will also estimate what your out-of-pocket costs will be, particularly for prescription drugs. So this is an incredibly useful and functional website. If you're not web savvy, don't worry, you can call Medicare and their 800 number and you'll get people who will help you and answer your questions. We also have a state health insurance assistance program. The national website is shiptocenter.org or hawaiiship.org. These are folks who are there to help answer your questions, help you deal with enrollment. And I've listed here the Hawaii SHIP phone number as well. So these are some very valuable resources as you're navigating the process of enrolling in Medicare and selecting a plan, selecting supplemental insurance. Use the Medicare.gov website. If you still have questions, hawaiiship.org. The next, a terrific source of assistance is also aarp.org/Medicare. Lots of answers to questions, lots of Medicare resources, guide to choosing your health coverage. All of that is available there as well. So, okay, so this is a good spot to, well, actually, I think what we'll do is go to the next slide, Jackie, and let's do the evaluation. And then we'll come back and make sure we've answered everybody's questions. So Ed, if you could put up the evaluation survey.
Also, Frank, don't forget we have Kaylee Lopez on to do some closing. And there do seem to be still a few questions in the Q&A.
Couple more coming in. Okay, I thank everybody for your feedback. We really appreciate that. So let's see if there are any questions. Any further questions, Ed? And then we have a guest speaker.
So
Okay,
Ed,
Frank?
I don't know if you know that you can pull that right-hand bar down in the Q&A and you can see additional questions. So I'll jump in if I don't see that you got them all.
Okay, yep. Okay, Frank. So again, talking about Medigap, can you enroll in Medigap at age 70 if you originally delayed enrolling in Part B because you worked and were covered under an employee's plan until age 70?
You know, I'm not absolutely sure of that. I believe the rules for Medigap is that you have to enroll at age 65, which doesn't make sense if you're not already, you're not enrolled in Medicare. I'm not sure about the issue of the delay.
Okay. I have dual coverage from my employer and my wife's. Do I need to register for Part B when I quit working, even though I still will be covered under her policy?
No, if you're still covered, and again, that her employer has more than 20 employees, you still have credible coverage and you do not need to enroll in Medicare until that coverage ends.
If I apply 3 months before my birthday, does it kick in right away or on my birthday?
Now you can specify when you want it to be effective. It'll start on the first of the month, typically the month of your birthday. And that's why you typically want to enroll in that 3 months before your birthday if you need that coverage to begin on your birthday or that month of your birthday.
How do I select a plan if I intend to move to the mainland, say 6 months after I turn 65 and retire?
The act of moving will open up an opportunity for you to change plans. One way to do that, though, is if you want to pick a plan here that is also national, like United Healthcare or Kaiser, you could do that and then switch the location of your plan. But also the act of moving opens up an opportunity for you to change your enrollment.
This is a really important one, I think, is in terms of employer coverage, is COBRA considered employer coverage in terms of being able to delay having to sign up for Medicare without penalty?
My understanding is that it is not, that you do need to switch and make the enrollment when your actual employer coverage ends.
Yeah, I think that's correct. And that's can be a gotcha, because it's only if you and your spouse are actively working that you can delay signing up without penalty.
Right. You have to be
Okay.
actively working. And then
Right.
when that ends, you have to get Medicare.
Exactly. Okay, so I want to make sure I understand this, Frank. I'm already collecting Social Security now. So when I turn 65, am I automatically enrolled in A, B, and D?
You're automatically enrolled in A and B. You will have to choose on your own a prescription drug plan, a Part D plan. And again, for those of you who may be getting Social Security but still working and have employer-based coverage, you may want to tell Social Security, please don't enroll me in Medicare when I turn 65. You can opt out as well.
I want to stick with my employer's insurance until I retire, but we're less than 30 employees. And my understanding, I have to apply within 8 months of turning 65?
No, I mean, if it's less than 30, but more than 20, you have your employer coverage is still good and you can keep that until you retire. Okay. So, and that's what I advise people to do, because you don't want to be paying a Part B premium that you're not going to get any benefit from. So the employer size starts at 20, not 30, if that's the issue.
Right. And there seems to be a lot of questions about this particular situation of people having either their employer or their spouse's employer less than 20. And I think your advice before is to really contact your employer's HR provider, right, and they'll let you know what you have to do.
Right. That's true. And you can also call Medicare. Medicare will help you with that. Again, the general rule is if your employer has fewer than 20 employees, 20 or fewer, I believe is the way it's worded, then Medicare is going to be primary and you should enroll in Medicare when you turn 65.
So here's a good one. Once I'm on Medicare, will Medicare notify me of the re-enrollment
Just to jump in really quick.
Okay. Will Medicare they'll let me know, will Medicare notify me of the re-enrollment period year after year?
Medicare does notify you of the open enrollment period every year when you're allowed to change your Medicare coverage. Plus, you'll be bombarded with mail. There'll be stuff on television all about Medicare enrollment. So it's hard to miss.
I think we're good, Jackie.
Okay.
I wanted to mention that the Hawaii SHIP, which is the state health insurance program, which has volunteer counselors for Medicare, can help you. I know a lot of people, half of the people in Hawaii work for small businesses that don't have an HR department. So while Kaylee is presenting, I will put that information into the chat and you can just copy it. It is a volunteer program, so you have to leave a message and a volunteer will call you back. But I know many people who have benefited from just talking with one of those volunteers about their situation. And it's a little bit easier to get them sometimes than calling the toll-free Medicare number.
Okay.
So Kaylee, are you ready?
Yes, aloha everyone. Thank you so much for letting me jump in for a little bit and participating in a presentation that I'd love to share with you folks while you're on the line. AARP Hawaii has introduced legislation, specifically a resolution to the Hawaii State Legislature, and it's Senate Concurrent Resolution 97 and Senate Resolution 76. The reason we're wanting to share this with you, and we'll see, I might be having a similar challenge the others had in trying to get my screen to advance. There we go. Here's what we know. Too many people are in danger of retiring, not just here, but across the country, and they have not saved. About half the people have not saved for retirement at all. Social Security alone will not support people. Here's a little bit of information about Hawaii on many families of those 65 and plus get an average of maybe 18,000 in Social Security in a year, but will spend at least 25,000 a year on utilities, food, and healthcare alone. What we also know is that many private sectors, businesses are no longer offering pensions. The other thing we know is that although individuals can open up an IRA now on their own, only about 5% of individuals actually do. That means another 95% either don't have access to a 401k or IRA unless it's through their employer, but many don't have that. So what we also know is that those who, aren't able to work and haven't saved will need to be supported by safety net, social service safety net efforts. And I'm sorry I misspelled COVID, but what we've seen with COVID and the pandemic is it's amplified the importance of having adequate savings. What we've also seen is that many seniors or kupuna have been struggling during this pandemic to just buy food and make ends meet. And again, the pandemic exacerbated that. What we also have found is that many small business owners want to provide retirement programs for their employees, but they're unable to do so partly because of the cost, the complexity and liability related to that. So AARP has been advocating across the country a program called Work and Save. So Hawaii Saves is a proposal that we have put forward to the state legislature. And what it does is it makes it easier for people to save via payroll deduction. What we've seen through studies is that people are 15 times more likely to save for their future if it's via payroll deduction. What the program is kind of a state facilitated approach to retirement savings. There's IRA, secure choice, as well as marketplace savings. The concept of utilizing payroll deduction, it has, people are automatically enrolled. There's an automatic escalation of how much is contributed to the retirement. And again, the payroll deduction. It allows employers and employees to pool. So from a small business, but all of these small businesses together are able to pool those resources and make it much more useful and meaningful for a financial organization to manage those resources. And the other thing, what it does is what we've estimated. So AARP's Research Institute was able to determine that if we were able to pass something like Work and Save, where people were able to have retirement savings, that it would save about 32.7 million in public assistance through 2032 alone. This includes reductions in SNAP, Medicaid, and other safety programs. So what I wanted to tell you is we have a resolution. I gave you the numbers up front in front of the Senate. We had one in front of the House and it died. The chair of that committee decided not to hear the bill. But what it would do is establish a task force, study the feasibility of a state retirement program, and the task force will deliver a recommendation to the state legislature for the 2022 legislative session. So there's about 216,000 workers in the private sector that do not have access to a retirement program via their business, via their employer. Many of these businesses want to offer those plans. And again, if we were able to, in fact, have such a program available in Hawaii, it would save a great deal, as I indicated earlier, about 3.27 million, 32.7 million. And at least 12 states have passed legislation for some form of retirement savings. Oregon, Illinois, and sorry, again, typing too fast. That's supposed to be California instead of Chicago, folks. What that is it's a way for those programs have demonstrated, the one in Oregon in particular has been in place for 3 years. And what they have seen is that those who are on average making about $29,000 a year are actually participating in the program, and they might only be saving $130 a month, but each of those months over a long duration will at least be better than not saving at all. I'm open to questions, but also want to leave it to Jackie to see if she'd like to move on to anything else. Or Ed, Frank, however you folks want to proceed on this.
So Kali, there's one question in terms of what financial institution would administrate Hawaii Saves?
So how other states have done it is a organization or board is formed. An organization is formed and the board is attached to a state agency. In other places, it's like the finance, but it is an independent organization or board. And they basically hire or contract out and put out an RFP to hire a financial institution to manage those funds. They've been very successful. And again, I think from that perspective, it would be, we might want to have the study look at whether there's value to pooling with other states, because Hawaii's pool of employees may be relatively small, and we might want to pool in with another state as well. But that's what the study would look at. And it's something we've been trying to pass for about 5 years now. We're hoping a study and a resolution would be a little bit easier. As I said, the House version died. And so, we haven't given up and we're still working. We're clear, and which is why AARP provides the kind of webinars that you folks have been participating in, because we understand the importance of saving for the future. And this program is meant to benefit those who do not have access to retirement resources and just aren't going to go out and open up an IRA on their own.
And one of our viewers points out that this would also make people less dependent on Social Security, which is also, the future of that is not 100% secure.
Exactly. And if you took the Social Security, the planning, or I was in your first session, Ed, you have to have multiple vehicles to save for the future. Savings, Social Security, retirement, potentially insurance of some sort. So there's many things you want to be able to have in place so that when you retire, it's not something you're having to worry about making ends meet from day to day.
Haley, this is Jackie. Can you hear me?
Yes, I can.
Thanks. I'm having some technical issues on my end, but is there a call to action that you would like to request from people that I can send out to them in an email afterward?
Absolutely. If you are interested, we will send you the bills themselves, the resolutions, and give you information related to the next hearing. We're very happy the Senate passed the resolution out yesterday with a few amendments, and we're hoping when that goes to the next committee, which is Ways and Means, if you have an interest, we would love to have you participate by submitting testimony. If you're up for it, you don't have to appear in front of the committee, but you can submit written testimony in support. So thank you.
And I think we want to put it a little stronger than that, right? We want to ask them to submit because people who are on the brink of retiring, how much it takes to save for retirement. And if you just take a moment and think about all the people who don't have anything and how that would help. I think we heard from so many people today who work for small businesses, which are the ones the most impacted by this situation. Yeah.
Oh, absolutely. Thank you. Thank you, Jackie.
Any other questions in the Q&A, Ed, before we end this webinar?
So here's one. Medicare, as Frank pointed out, does not cover long-term care. Where can I go in AARP's website to find information on where I can get long-term care coverage?
I don't think that is on the AARP website. for long-term care. I think you'd have to go and search for long-term care insurance companies. I'm not sure where one would go for that, but I don't know. AARP does not, I believe, sell long-term care insurance in Hawaii.
Okay. And Kaylee, they're talking about Hawaii Saves again. How would this affect IRAs? Does this resolution make it a mandatory deduction for employees?
You're on mute, Kaylee.
It's mandatory. It's not so much mandatory as it is an opt-out requirement. What other retirement programs have seen, say, with any kind of retirement program, is they often have members have to opt out, employees opt out. So an employee can opt out of participating in Hawaii Saves. So they don't have to. We just want to make it very easy for them if they do want to save.
And Frank, just a couple of questions again. I think a lot of interest in people who are considering either they're working or a spouse is working past 65 and then converting to Medicare. So here's one. My husband's the breadwinner. I'm fully invested in Social Security from previously working. I don't earn income now. But if my husband continues to work until I turn 65 and his health insurance remains primary, will I still have to enroll?
Okay. If you're covered under your husband's insurance, you do not have to enroll in Medicare when you turn 65. You can wait until he retires and that coverage ends, and then you both can enroll in Medicare, and you've got 8 months to do so, but do it before your coverage ends.
Jackie, I think we're good.
All righty. Well, thank you everybody for participating, and Frank and Ed and Kaylee, thank you so much for presenting. If you are signed up for it, next week we'll be doing investing for retirement. If you're not signed up for it, a little hint is that you could use the same link that you used this week in order to participate next week, although we sure love it when you do register. But we want you to get the information one way or another. So just use this week's link and you can tap into next week. And then finally, I do want to mention that I have embedded the recordings from the last 2 sessions onto the landing page of the registration site. So if you're asking, can I get a copy of the slides? Can I get a copy of the recording? It's on there. And I put that location on the chat. If you move up to the chat, it's the view. So hopefully you'll get the information that you need. And again, thank you so much for coming. We hope that it has contributed to your planning, and we look forward to seeing some of you next week. Mahalo.
Mahalo.
Aloha, everyone.
Take care.
Take care.